New Mexico Cancer Center and Health Specialists of New Mexico are the proud sponsor of Health and Wellness on New Mexico Living.
Every year, Albuquerque The Magazine solicits the medical community to vote for the top doctor in each specialty. And we are so proud. Dr. Lin, Dr. Sterner, Dr. Nazan, and Dr. Ownby, all from New Mexico Cancer Center, all in different specialties, won that great honor this year. It is the biggest honor for any physician to be named as a top doctor by their colleagues and their peers. When you think about it, the people who really know whether or not you're doing a good job are the other doctors you work with, your peers, your colleagues, the people you share patient care with. Dr. Lin, a medical oncologist, Dr. Sterner, one of our rheumatologists, Dr. Ownby, our new neurologist who's joined us for our Alzheimer's program, and Dr. Nazan, who is one of our pulmonary doctors. That shows that we are doing a great job in all of the specialties we're working on. We have very purposefully built a culture at New Mexico Cancer Center that promotes excellence. We have made sure that we get rid of all of the barriers to delivering good care that we can possibly get rid of. We make sure that our physicians are comfortable being collegial with each other, asking opinions, getting help from other specialties, so that when we come up with a treatment plan that fits the patient in front of us, that we have really gathered together the best information we can. And it doesn't hurt that we are recruiting really good physicians. Not named this year, but she'll be there in future years, I bet, is Dr. Colleen Kerrigan, who is our brand new breast surgeon, who we just recruited from Princess Margaret Hospital in Toronto, Canada, to come to New Mexico to help us elevate the level of breast cancer care for New Mexicans. We're so thrilled to have her here. New Mexico Cancer Center has a lot of advantages from not being part of a big hospital system. I look at big hospital systems as being big battleships that it's very hard to turn and maneuver. New Mexico Cancer Center is a little speedboat. When we need to make a change, when we need something for a patient, when something needs to be done now, we can be very responsive, and we can make those changes, and we can continuously do a better job. The other hidden secret that most people don't know is that if you walk into a hospital or see a hospital-based physician for anything, you're going to pay a big facility fee. The hospital has negotiated big price tags with all of the local payers, and so you will discover that your out-of-pocket costs are significantly higher because you're paying for all of that hospital infrastructure. When people come to us, we're paid under the physician fee schedule, which covers the cost of our employees and our physicians, but we're not paying for all of the expensive things of a hospital that you're not using that day. We built New Mexico Cancer Center and the practice, New Mexico Oncology Hematology Consultants, so that every member of our team works to the highest level of their license. The physicians are the leaders of the team because they are the ones who have the education and the expertise to be able to set out the treatment plans for patients. But we couldn't do it without every other member of the team. Our patient care coordinators navigate all of the making appointments and making sure things get done. Our financial counselors are our navigators who make sure that the insurance companies do what they're supposed to do. We have nurse navigators on the phone who manage the process. If you have a complaint, any version of "I don't feel good today," your phone call will be answered within an hour on a weekday while the practice is open. That's unheard of anywhere. And if you need to be seen today, the answer will be, can you come in at 2 o'clock? Not, would 3 weeks from next Thursday work for you? So we really structured everything we do so that when a patient needs something right now, we can deliver it right now. Receiving votes to elect our doctors as top docs for New Mexico means that we have built a great working relationship with other physicians in other specialties. No one specialty can take care of patients alone. We all need the members of other specialties, from primary care to neurosurgery to everything in between, to be able to do a good job for the patient in front of us. So our doctors have worked hard to build those good working relationships. Communication between doctors is a rare event, and I will tell you that what communication between doctors means is not that you're in the same medical record, or you don't have your paycheck signed by the same guy on the front, like a big hospital system. What it means is you have doctors who share their cell phones with each other. They pick up the phone, they text people and say, call me about Jane Doe. I need to talk to you about her. And they do it. And that communication and the fact that doctors we work with know that they have our doctor's cell phone, we will get back to them right away, we will communicate the plan, we will share our concerns about a patient, and we will come together on a way to move forward for the benefit of that patient. That's what builds trust among patients and among doctors, and that is, I believe, why we earn the top doc votes year after year.